Acupuncture Continuing Education Online, www.healthcmi.com. Today in the news, acupuncture benefits patients with Parkinson's disease. Researchers discovered that acupuncture helps improve cognitive abilities, emotional stability, and daily activity living scores for patients with Parkinson's disease. This was achieved by combining electroacupuncture at scalp acupuncture points with standard pharmaceutical medications. What they discovered was basically that if you give people standard pharmaceutical medications, there can be some improvements. However, there are also adverse effects. Firstly, acupuncture reduced the adverse effects of the medications, allowing patients to tolerate the drugs without nasty side effects. Number two, acupuncture significantly and dramatically help patients with mental capacity and balancing issues concerning mental illness associated with Parkinson's disease. In other words, the emotions were more stable. They could think more clearly. There was less cognitive impairment. The rates, the overall total effective rate for patients receiving only drug therapy, 73.3% had some improvement with drug therapy. However, by adding electroacupuncture at scalp acupuncture points into that equation, that total effective rate jumps to 87%, suggesting that this is a very important treatment for patients with Parkinson's disease. If you have not read our several articles at healthcmi.com, go to healthcmi.com, click on news, and take a look at the article on Parkinson's disease in December of 2016. You can also search through the archives and find many articles on how acupuncture helps patients with Parkinson's disease. There's quite a lot there. Quite a few studies have been done. I also recommend taking a look at a very special study we published in 2015 entitled MRI Reveals Acupuncture Modulates Brain Activity. Now this one is very interesting. It was published in Autonomic Neuroscience, and it shows that specific acupuncture points cause specific hemodynamic changes in the brain. In other words, acupuncture point specificity is measurable with MRIs. What they found basically, and I quote, is that more positive and negative hemodynamic signal responses in brain regions compared with sensory stimulation were used as a control condition. In other words, acupuncture can balance different hemodynamic signals in the brain. Take a look at that. It's rather detailed, but it will give you some insight into how we have shown with fMRI studies that acupuncture can redistribute signals in the brain back to normal levels. Another recent article covering that topic was published entitled Acupuncture Activates Brain on MRI, Relieves Depression, published November 28, 2016. That one specifically shows that acupuncture normalizes brain functions in patients with major depressive disorder, and depression can be significant for patients with Parkinson's disease. But what we found was that patients without mental illness, with healthy brain activation, functional connectivity, had one set of parameters that were visual on the fMRI. So we can visualize healthy connectivity and activation of brain centers for healthy patients. However, patients suffering from major depression had another set of patterns in the brain that were unhealthy patterns. After the application of acupuncture, those unhealthy patterns found in the major depression patients then reverted to the normal signals found in the healthy patients. Take a look. It's detailed. It's even tough to talk about. It's so important that patients, not only with major depression, but patients with Parkinson's disease, get the help they deserve. Visit www.healthcmi.com. If you like it, share on Facebook, Twitter, Google, LinkedIn, Pinterest, or leave a review on the podcast. Thank you so much. www.healthcmi.com, Acupuncture Continuing Education Online.